Hello guys, and welcome back to another video. Today we're going to touch on the ethical pillar of continuing professional development. Now, in the General Dental Council's 9 standards for the dental team, the 7th principle is to continue to develop and maintain your professional skills and knowledge, or words to those effect. And a big part of this principle is the concept of CPD, continuing professional development. This is the whole idea that dentists need to go out there, but not just dentists, nurses, dental therapists, and other members of the dental team, and engage in regular forms of learning to keep all their knowledge up to date and carry on learning about the new advancements that are coming out. Let me give you some context. In 2017, the way in which we started to diagnose and give a diagnostic statement for a disease like gum disease completely changed because new guidance came out. Now, as dentists, you need to learn that new guidance and implement it so that you're giving your patients the best possible care. That's where CPD comes in, and constantly learning to give your patients the best service. Now, as dentists, we need to do 100 verifiable hours every 5 years. Now, verifiable means that the content of the CPD has to be verified and of genuine good source. Now, what are the different forms of CPD? When should you even think about doing CPD, and what guides it? Let's get into each one of them. So, different forms of CPD. The GDC categorizes types of CPD into different forms, and they have a whole part on their website where they go into this, and they'll break it into 4 domains: A, B, C, and D. Some of these topics might include your communication skills, or managing medical emergencies, or getting updates on how to review radiographs, or radiography guidelines, or team working skills. But then there's a whole domain related to safety and following regulations in accordance to CQC and other key bodies. Another form of CPD might also be related to ethical pillars, so keeping sure that we are up to date with guidance on things like confidentiality, GDPR rules, and safety in the practice as well. Now, a big part of CPD is also the learning that we do, the hands-on skills. So we're encouraged to go and study via hands-on course days, or via online seminars or in-person seminars on techniques, tips, and tricks that we can do with patients when we're doing treatment to make sure we're offering them the best possible service. For example, you might see dentists going on composite courses or doing postgrad diplomas. These are all going towards their CPD hours to make sure that their skill set is constantly developing. Now, when should you even think about doing CPD? Obviously, naturally, you will be finding deficiencies in your work and think that you need to go on and improve them, and that's a trigger to do some CPD. Sometimes you might get a complaint from a patient. This could be on anything: the way you worked with the nurse, the way you dealt with them, the fact that you constantly overrun. When you get complaints or when you get feedback from patients, you have something called an EPDP, an online personal development plan. And in that portfolio, you can write and reflect on things that are going wrong with your clinical work or with your patient management, and then that gives you a guide of things to target in the CPD that you do. So that's another trigger to find out what needs to be worked on. Also, you will have team training days in practice where everyone together will engage in CPD. So that's another way to get some more learning or keep your knowledge up to date. And generally, if you do get a complaint or something goes wrong in practice, that is another trigger to go on and do some extra learning. So how does this tie into interviews, and when should you speak about it? Well, if you're asked any personal quality question where you've had a weakness or dealt with a failure, explain how you bounce back from that, and you can link it to CPD and say that as dentists, you will constantly make mistakes and have new things to learn. So you're going to carry on reflecting on yourself and going on courses and doing things and learning from mentors to keep improving. And that shows that even when you have a failure now, you're thinking about how your resilience can be transferred to dentistry as well. And then secondly, if you're given a scenario where a dentist has made a mistake or a dentist is struggling with something, you can always say how they can go on CPD courses. That's just 2 ways you can talk about it, but really it's a very versatile concept that you can tie into loads of questions. Obviously ethical questions as well. So that's a quick run through of CPD and what it is, and we'd recommend that you star this video and make some notes on it, because it'll definitely serve you as a good talking point in your interviews. That's it for today, guys. Thank you for watching, and hopefully we will see you in the next one.